Welcome back. I'm Ryan with Kinesis PT and Performance. Today I am going to discuss with you the difference between a medical diagnosis and a movement diagnosis. Now, before we get into this topic, I like to use analogies to convey points. A little story about a patient. It's kind of a funny one. So she came into our office and we were just happened to be talking about cars, and my truck's always breaking down. If you know me, it's always a problem. And she was telling me she discovered for the first time that you actually have to get your tires rotated on a car. So she took her car into, I don't know, one of the local places around here, Bell Tire Discount, something like that. They told her, I'm sorry, ma'am, your tires are completely bald. We got to get you some new tires. But after you get new tires on, you got to go and get your alignment checked. Your alignment is way off and it's killing your tires. She had no idea what an alignment was and thought it was semi-normal to be driving down the road with her arms kind of cocked sideways, so she was turning the whole time she was trying to go straight. So yeah, had those people at Discount Tire or Bell Tire, wherever it was, not told her that she needed to fix her alignment and she just would have kept driving around, she would have been right back at their store needing new tires because her tires would have balded because the alignment was off. Long story short, they could have made a lot more money had they not told her that, but thank God they're good people. Now, how does that relate to a medical diagnosis versus a movement diagnosis? Well, if you think about the bald tires as being the medical diagnosis and the alignment being off as the movement diagnosis, that's the parallel here. So a lot of times you can go to your physician and you're like, oh, my elbow hurts. And doc takes a look at it and goes, oh, you have a tendonitis. If you have a golfer's elbow or a tennis elbow. Great. That's awesome news, doc. Okay. Thanks for telling me I got a tendinopathy or a tendonitis. Now what? Why do I have it? I don't golf. Why do I have golfer's elbow? The medical diagnosis leaves out the why behind why you have that issue. In reality, that is a symptom of an underlying movement problem. Now, don't get me wrong, sometimes you can get a tendonitis when you start a new activity and the musculotendinous junction isn't strong enough or has not been prepped for that level of activity. You can get a tendonitis. That's not unheard of. Sometimes it's as simple as progressive loading and strengthening and you're good to go. For a lot of people who do things like running or some other activity they've been doing for a long time and then they develop a problem, that type of new load cannot be the answer to why they're having this issue. Or just a simple explanation of you're not strong enough in this area, that leaves out a huge picture that has not been addressed in terms of how are you moving, how are you displacing your stress across the body. There is definitely a right way to move and a wrong way to move. This is evidenced through a lot of different research articles out there, whether you're looking at the shoulder, the back, the knee, the hip. If you're not moving the correct way, you're going to continue to place excess stress on those tissues, and you're going to continue to experience pain and symptoms regardless of what your medical diagnosis is. You have to address the underlying movement dysfunction. Had my patient not got the alignment fixed on her car, and she kept driving around, she would have been right back at the Bell Tire Discount Tire place buying a new set of tires. The same exact thing can be said is if you go and you have some irritated shoulder or elbow, maybe it's your knee, you get a cortisone injection and you go right back out to doing stuff the same way you were before, you're going to be right back at the doctor's office a few months down the road with the same issues going on because you didn't address the underlying movement dysfunction or movement problems that were exacerbating your symptoms in the first place. Do not get hung up on the medical diagnosis. It's important, don't get me wrong, it's a part of the picture, especially when it comes to understanding what tissues we're dealing with and tissue healing time frames. That's important. However, if we don't address why that medical diagnosis has occurred, it will reoccur. If you're working with a therapist who is not addressing how you move and is telling you it's just something as simply as, oh, we have to make this one muscle stronger, run. Run fast, because that's not how the body works. The body works in chains of muscles. It's a symbiotic system of movement. Nothing functions independently of anything else. So when you're going through rehab, if they are not addressing changing your movement or trying to improve how you move, you're probably not in the right place. Below in the description, I've left some links to a couple articles. You can check these out. They kind of reinforce what I'm saying, but you know what I say about research, take it with a grain of salt. You got to still think for yourself and draw your own conclusions. Before I go, just want to give a shout out to our girl Sophie K. She trains with my wife. She's an up and coming star singer, so give her a check on YouTube or Spotify. She's pretty awesome. All right, thanks for checking our video. Have a great day. Bye.